My name is Erik Nilssen. I'm a board-certified orthopedic surgeon specializing in foot and ankle surgery. So plantar fascia is a thick band of tissue in the bottom of your foot. It attaches from your bottom of your heel all the way to your toes. It helps support the arch of your foot. It's a vital structure, and unfortunately, it's the most common injured foot complaint really in the world. So plantar fasciitis is really not an inflammatory condition, even though you think it is. It's a degeneration of the plantar fascia, typically at the insertion of the heel. It commonly presents itself, wake up in the morning, heel pain. As you get going, it feels a little bit better. And you sit down again, get back up, pain arises again. Very debilitating. It's a huge problem in the world. Everybody gets it. The good news is it's about a 95% cure rate with non-surgical treatment. However, it's extremely expensive to the industry, to the world, healthcare in general. In 2007, there was a study put out. It cost the healthcare payers $400 million in 2007, so 11 years later, I think we're looking at probably over $1 billion, all this being pushed to you, the patient. Well, seeing a lot of foot conditions in my practice, I see 2 to 5 plantar fascia patients a week. And in seeing these patients, you know, the fact that it's 95% cure rate with non-surgical treatment, I begin to realize these patients are often seen initially by their primary care physicians and then referred to me. And with healthcare changing so much now and premiums skyrocketing and the cost being so expensive for the patient, I said, what can I do to keep a patient from coming to the doctor to save them money? Because they're all paying cash, even though they're not, even they have insurance. It's all being pushed on the patient. So I thought this would be a great way to help control costs for the patient and give patients, you know, a great quality product. There's no kit out there in the world that I know of that's the most complete kit. So we put everything together in one kit for the patient, makes it easy to get and access. Everybody in the world can get it because we can ship this anywhere in the world to you. So in the comprehensive kit we put together, most importantly is information. We've got a wonderful booklet, and this is a picture of the booklet here that comes with each kit. It's very, very comprehensive. It has all the background information on plantar fascia, everything you want to know about it. How do you diagnose it? How do you treat it? More information than you probably want to read, but it's all in here contained in this book is one thing we have. The other piece we have in the kit is a plantar fascia night splint. And the key to plantar fascia treatment is really stretching out your calf muscle, because oftentimes the Achilles tendon in the back of your calf is attached to your plantar fascia. People don't realize that, but it's one big unit. And so it's hard to stretch out your plantar fascia, much easier to stretch out your calf muscle. So what you do is you put this on your leg at night and it keeps your foot stretched out. It's very handy, very easy. It's very soft as well. There's many of them out there, but a lot of them are rigid and plastic and uncomfortable, and we find this to be the most comfortable and most effective. So this is a night splint that comes in your kit as well. The next piece of equipment is a roller ball. So what this does is this lays on the ground and it's got some sort of soft, sort of rubbery feel to it, and you take the bottom of your foot and you get to desensitize and you get to really massage the plantar fascia. We find this has the best penetration to the plantar fascia and provides the best cure, if you will, in addition to the other modalities that we have. But this is a very effective way of treating your plantar fascia. When you're walking in your shoes, again, it's quite painful, but as your treatment path continues, we find these are very effective as well. These are heel cups, heel gels, and so it's got some give to it. It's kind of low profile. There's some thicker ones out there, but I think they're just too uncomfortable. We find these to be the most comfortable for you and the most beneficial. So these heel cups can go in any shoe you wear, and you wear these throughout the day to take some pressure off that heel. This is a midfoot splint, and so the thought of this is very similar to someone who has, say, tennis elbow, and so they have an elbow issue. They wear what's called a counterforce brace, takes pressure off the pull of that tendon. Well, this can slip on your foot and actually provide a little bit of counterforce against the plantar fascia further from the heel, and it's not talked about much, but we find this to be also another helpful tool for you. We also have a TheraBand, which is the mainstay of treatment, which is stretching out your calf muscle to take pressure off your plantar fascia. and with that has a series of exercises on how to use that band effectively. So that's the complete kit, all packaged together. Please pick one up at nilssenorthopedics.com.